Hello, dear students. Today we are going to learn about the endoderm and its derivatives. Endoderm is the innermost lining of the embryo. It forms after gastrulation and lines the innermost portion of the embryo. This is the embryo. It starts to fold in the cephalocaudal as well as lateral directions, which causes the enlargement of this amniotic cavity, and the yolk sac start to reduce in size, and it gets internalized by the pressure of the developing embryo, due to which there is only a small connection remains with the yolk sac, which is known as vitelline duct. This vitelline duct connects the midgut of the embryo with the yolk sac. When we see the embryo, then we can see the tube which is lined by the endoderm. This whole tube which forms the gut in the future, it is known as primitive gut tube from the pharynx to the anal canal, except the distal one of the anal canal and the proximal part of the oral cavity. It completely lines the gut tube. Here we can see in this diagram, it also forms the lung bud, the liver bud, the pancreatic bud, and in this diagram we can see it also lines the pharyngeal pouches, and it also lines the urinary bladder. Now we are going to learn what derivatives endoderm form in the future. In GIT, gastrointestinal tract, it lines the epithelial lining from pharynx to the upper anal canal, excluding the oral cavity and lower anal canal, which are ectodermal. In respiratory tract, it forms the larynx, trachea, bronchi, alveoli via the laryngotracheal diverticulum. In digestive glands, it forms the liver, pancreas, gallbladder. In pharyngeal pouches, it lines the first pouch, which forms the eustachian tube and middle ear cavity. It also lines the second pouch, which forms the palatine tonsil. It also lines the third pouch, which forms the inferior parathyroids and thymus. It also lines the fourth pouch, which forms the superior parathyroids and ultimobranchial body. Ultimobranchial body forms the parafollicular C cells of the thyroid, but these are neural crest derived. Endoderm also forms the follicular epithelium of the thyroid gland, except the C cells which are derived from the neural crest. Endoderm also lines the urogenital tract, that is the epithelial lining of the urinary bladder, except the trigone, urethra and distal vagina. It also lines the prostate, vaginal vestibule. Now we are going to discuss few clinical correlations of endodermal development. Case 1, tracheoesophageal fistula with esophageal atresia. A newborn has excessive salivation, choking during feeds, and distended abdomen. A nasogastric tube coils in the upper esophageal pouch on X-ray. As we can see in this diagram, there is uh, the coiling of the NG tube in the esophagus. A diagnosis of tracheoesophageal fistula with esophageal atresia was made. Embryology correlation of this is due to the failure of proper separation of trachea and esophagus from the foregut endoderm. And clinical relevance, it has a risk of aspiration pneumonia and requires the surgical correction. Now come to the clinical case number 2, Meckel's diverticulum. Meckel's diverticulum. A 5-year-old boy presents with a painless rectal bleed. A technetium 99 scan shows uptake in the lower right quadrant. This scan is very specific for Meckel's diverticulum detection because it detects the gut mucosa. So, the Meckel's diverticulum is lined with the gut mucosa or sometimes with the pancreatic mucosa also. It is due to the persistence of vitelline duct which connects the yolk sac to the midgut. Remember the rule of 2 in Meckel's diverticulum. It, it is seen in 2% of population. It is 2 inches long, 2 feet from the ileocecal wall. Two types of mucosa it can contain, gastric as well as pancreatic, and it presents by the age 2. So in this scan, we can see this is the uptake. It is due to the Meckel's diverticulum. Now come to the case number 3, congenital hypothyroidism. A neonate has prolonged jaundice, constipation, overfeeding, and hypotonia. Newborn screening shows elevated TSH levels and low T4 levels. A diagnosis of congenital hypothyroidism was made, and embryologically, thyroid develops from the endodermal structure, which is the outpouching from the primitive pharynx, and starts to migrate from the floor of the mouth through the foramen cecum to the neck. It starts to migrate from the floor of the oropharynx and to reach to the neck, and any abnormality in this path can result in ectopic thyroid, which can cause congenital hypothyroidism. Treatment is early thyroid therapy, which is very important because otherwise congenital hypothyroidism causes irreversible intellectual disability. Another case is of anorectal malformation. A newborn does not pass meconium within 48 hours and has abdominal distension. Examination reveals no anal opening. The diagnosis of imperforate anus was made. It is due to the failure of breakdown of cloacal membrane or improper division of cloaca, and management is surgical intervention depending on the level of malformation. Fifth case is congenital pancreatic agenesis. It presents with the severe hyperglycemia in neonate with ketoacidosis. Imaging shows the absence of pancreatic tissue, and it is due to the failure of development of dorsal or ventral pancreatic buds from the endoderm of the foregut. It requires insulin therapy and may also present with exocrine pancreatic insufficiency. So this is all for today. Thank you.